Hi everyone, welcome back to my YouTube channel, and today we are going to talk about frontal bone. So let's start our topic with introduction. Frontal bone is one of the unpaired cranial bones of human skull. It is located at the front of cranium, as you can see in diagram. It plays role in protecting the brain and forming the framework of forehead, eye socket and nasal cavity. Being a single bone, it occupies a central position and articulates with several other bones of the skull. Location and structure of frontal bone. Frontal bone lies at the anterior part of cranium. It consists of a vertical portion, that is squamous part, that forms the forehead, and a horizontal portion, that is orbital part, and it contributes to roof of orbit and nasal cavity. At birth, it develops in two halves which fuse during early childhood at the metopic suture. In some adults, this suture may persist. Parts of frontal bone include its squamous part, orbital part, and nasal part. Now let's talk about these parts one by one. So first part of frontal bone is squamous part. This part forms the forehead. It contains frontal eminence, that is rounded elevations on either side, which are more prominent in children and females. They include the supraorbital margin that form the upper edge of the orbits. This part also contains a supraorbital foramen or notch which transmit nerves and blood vessels to the forehead. Next part of frontal bone is orbital part. This part forms the roof of the orbits, that is called as eye sockets. It contains depression for lacrimal gland and grooves for blood vessels. Next part of frontal bone is nasal part. It is situated between the orbits. This part articulates with the nasal bone and forms part of nasal roof. Special features of frontal bone include frontal sinuses. They are two air-filled cavities that are located inside the frontal bone above the orbits. They lighten the weight of skull and contribute to the resonance of the voice. Next feature of frontal bone is glabella, that is a smooth area between the eyebrows, as you can see in the diagram. It is located just above the nasal bridge. Third feature of the frontal bone is superciliary arches. There are bony ridges above the orbit that are more prominent in males. Articulations of frontal bone. Frontal bone articulates with 12 bones of skull. It articulates with cranial bone and it also articulates with facial bone. From cranial bone, it articulates with two parietal bones, one sphenoid bone and one ethmoid bone. Talking about facial bone articulation, frontal bone articulates with two nasal bones, two zygomatic bones, two maxillary bones, and two lacrimal bones. Functions of frontal bone. First function is protection, as frontal bone forms the anterior part of skull and safeguard the frontal lobes of the brain. Second function is support, as frontal bone contributes to the formation of forehead, orbits, and nasal cavity. Third function is facial structure, as frontal bone gives shape and prominence to the upper face. Fourth function is air passage regulation, as frontal bone houses the frontal sinuses which are involved in air filtration and resonance. Fifth function is attachment, as frontal bone provide anchoring point for muscles of facial expression. Conclusion of this lecture video. Frontal bone is a single, strong cranial bone that plays an essential role in structure and protection of the skull. It contributes to the forehead, eye sockets, and nasal cavity that houses the frontal sinuses and articulates with several other bones. Its importance lies not only in protection of brain but also in forming the characteristic appearance of human face. And this was all about frontal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.